Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. We are continuing our videos about dental anatomy at a glance, and today we are going to talk about the permanent maxillary canine. Inshallah, if we completed this tooth, we will shift to the mandibular anterior teeth so that the dental anatomy of the maxillary and mandibular anterior teeth will be completed. Now we will start with the permanent maxillary canine. We will start with the facial labial aspect, the proximal contacts, as you can see in the picture. The mesial proximal contact is at the junction of the incisal and middle third, and the distal proximal contact is at the middle third. The cusp has a mesial slope and distal slope, the mesial slope being the shorter of the two. As you can see in the picture, the mesial slope of the cusp is shorter than the distal slope of the cusp. Now we will continue with the lingual aspect. We have three enamel ridges: the mesial and distal marginal ridges, and the cingulum, which is large, centered mesiodistally, and the incisal cusp ridge, mesial incisal cusp ridge and the distal incisal cusp ridge. We also have the lingual ridge, which connects the cingulum to the cusp tip. This is the lingual ridge, connect the cingulum to the cusp tip. And we have a deeper pronounced two lingual fossa. In the central and lateral incisor, we only had one lingual fossa, while here we have two lingual fossa. As you can see here, we will review our landmarks from a lingual aspect, from an incisal aspect. From lingual aspect, we can see the cervical line, the cingulum, the mesial marginal ridge, and the distal marginal ridge, the mesial lingual fossa and the distal lingual fossa, the mesial cusp ridge and the distal cusp ridge, and we can see the lingual ridge. This is the lingual ridge, connect the cingulum to the cusp tip. From incisal view, we can see the distal cusp ridge and the mesial cusp ridge. We also can see the distal lingual fossa and the mesial lingual fossa, and we can see the cingulum. This is the lingual ridge connecting the cingulum to the cusp tip. We have a note: the root of the maxillary canine is usually the longest of any root, with the possible exception of that of the mandibular canine, which may be as long at times. So the root of the maxillary canines and occasionally the mandibular canines are the longest of any roots. We will keep that in mind. Now we have some keynotes. The crown length is 10 mm, the crown width mesiodistally is 7.5 mm, and the root length is 17 mm, and we noted that this root is the longest of any root in the arch. For chronology, the eruption of this tooth is at the age of 11 to 12 years, and the root completed at the age of 13 to 15 years. For clinical importance in operative dentistry, if we have a filling, a class 3 or class 4 filling, or even caries in the lingual surface, and we are going to restore the tooth, it is very important to note from incisal aspect, to note the cusp ridge, the mesial and distal one, and to note the marginal ridges and the lingual ridge. We said the lingual ridge connect the cingulum to the cusp tip. That's all for the maxillary permanent canine. Inshallah, we will shift in the next videos to the mandibular anterior teeth, so that the dental anatomy of the anterior teeth will be completed, inshallah. Thank you for watching, and I will see you in the next video, inshallah.